Is COVID-19 causing you anxiety? And if it is, you're not alone. A global pandemic is upon us. Every business is affected in the United States and around the world. People are being laid off. They're signing up for unemployment. Schools are closed. The year's done. Many parents are struggling to work from home if they have that luxury and manage their children's academics as well as their boredom. Many people are self-quarantining or self-isolating either because they are sick or they're afraid they're going to infect other people around them. Those healthcare professionals who are working longer and harder days than ever before need childcare. They are experiencing emotional overload and feelings of helplessness, extreme stress, and anxiety. What can they do to reduce these feelings and take back control of their lives? Let's examine that. First of all, and I mean this in the most clinical sense, a lot of people say they have anxiety, but it's really not anxiety. Okay, bear with me for a minute. While many people believe that they have real clinical anxiety, it might be mistaken, misperceived for overconcern, excessive worry, or normal stress. Caution should be exercised when self-diagnosing. True anxiety, clinical DSM-5 anxiety, involves a number of signs and symptoms, including things like worrying excessively, feelings of dread, feelings of intense fear, as well as many other clinical characteristics. So there are physical symptoms. Clinical anxiety consumes a lot of energy, and it can create fatigue and lethargy. It zaps you. While experiencing episodes of anxiety, one might have heart palpitations, accelerated heart rate, and sweating. Physically trembling or shaking may occur, and you might experience shortness of breath, chest pain, and nausea. Some individuals will also feel dizziness and perhaps lightheadedness. What about the emotional symptoms? Individuals who experience clinical anxiety may become more irritable than normal and fly off the handle for almost no reason whatsoever. Reactions may be larger than the actual issues taking place. Some people will feel fear, loss of control, derealization, or depersonalization. Biological symptoms of anxiety. Besides physical and emotional symptoms, one may develop sleeping difficulties, including the inability to fall asleep, stay asleep, or waking up too frequently in the morning. Appetite dysfunctions may also occur and can include stress eating, binging, undereating, losing one's appetite altogether. Food may no longer be enjoyable, and one can experience maybe nausea or gastrointestinal problems due to anxiety. So are you thinking about your own emotions now? I hope so. Think about them in terms of physical symptoms, emotional, and biological symptoms. So what is triggering anxiety? Let's talk about that for a while. Some individuals are more susceptible to anxiety, while others are resilient and can better cope and manage their feelings through various crises. It's important to know what might be triggering anxiety in order to reduce or eliminate it. You have to know what's setting you off. For example, television news provides wall-to-wall coverage. Everything is COVID-19. Depressing, distressing, anxiety-provoking images and stories. There are way too many of them online, on television, everywhere. Overwatching television, overdoing it online may not be in your best interests if it is causing you anxiety. Take a break from the news. I had to. I like being on top of all of this stuff, and I'm always searching this, COVID-19 and depression, COVID-19 and anxiety, COVID-19, blah, 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 blah. But there are times when I say, you know what, I want to get back to learning about gut health and what's new in Alzheimer's research. And, there's so many other interests that I have that it can't be COVID-19 24/7. Maybe tune in just a couple times a day to reliable sources. If you're going to go online, Centers for Disease Control and Prevention is a good website. How can we better cope? If you are really experiencing panic and fear and anxiety, they're going to decrease your quality of living and might do worse, might cause some real physical problems. One of the best ways to deal with anxiety is to think about what you're thinking about. What's on your mind most of the day? In other words, how much time do you spend thinking about COVID-19 and why? Is it becoming an obsession? Have thoughts become overly negative? If so, then it's time to separate what you're thinking about and make room up here for other positive, rational, and happy thoughts. It is possible to compartmentalize. COVID-19, you're going to live over here. Gut health, you're going to live over here. You know, all of these other things, there's room in there, but you have to make room. Put your thoughts into little drawers, pull them out every now and then. Keep moving. Keep moving. One of the worst outcomes of anxiety is making people freeze their movements. Anxiety can stop activity, slow you down, zap your energy. Get outside. I don't know if you could tell, but the sun, it's beautiful. I have the windows open. I'm getting fresh air and sunshine. My plant is happy. Getting exercise, going for walks, while practicing social distancing and using your energy wisely can help reduce feelings of anxiety or panic. Exertion during the daytime can also lend to better sleeping at night. So stay busy, because keeping busy might take your mind off of COVID-19 for a while. It could also boost your mood and help you to enjoy life. There's a lot to enjoy. There's a lot to enjoy. Here's some final thoughts. While some people may believe they're clinically anxious, they may be experiencing less severe conditions like excessive worry, obsession, or just major distress. These feelings are serious and should not be ignored, but it's important to be careful if you're self-diagnosing, because you could really make your own mental health and emotional state much worse by doing that. These are highly stressing times, and it is normal, quite honestly, to feel anxious, apprehensive, and helpless. If these feelings do become overwhelming, seek professional help. Call, talk to your family, talk to friends, talk to a spiritual leader. Once the crisis is over, it will be great to get back to life before the virus. I'm Dr. Jim. I'm out of time. Thank you for tuning in. I'll see you soon.